looking for fun and feeling groovy. Ba-da-da-da-da-da-da, feeling groovy. I'm Kimberly Bensen, and this is Feeling Groovy, a show about health, wellness that asks us, what gets you feeling groovy? If you want to keep your positivity vibe up, stay healthy, and ride the wave of wellness, this is your ticket to ride. In this episode, we're going to explore sleep and how that affects our health. As a chiropractor myself for over 25 years, I've seen the effects of poor sleep issues firsthand, and how just a little bit of knowledge and some simple sleep solutions can reverse these health issues. So sit back, wake up, and let's get started. I'm Kimberly with KCAT TV, and we're feeling groovy tonight. We're asking about what makes you feel healthy.
Sleep. I don't get enough sleep, so when I do get sleep, I feel revitalized.
And so how many hours of sleep is enough?
Oh gosh, I can survive with 6, but I would like to have 8.
What's preventing you from getting 8?
And I'm a very light sleeper.
Can we please not make this an entire production tonight? Now that's up to you. Is your room the precise temperature that I demanded?
Yes, and I've already turned on the noise machine.
Perfect. Well, except for the fact that you've been staring at your phone for the past 3 hours, and you know I'm not going to be around you after you've done that.
If it didn't take you 4 hours to show up every night, I wouldn't have to find something boring to do while I'm waiting for you to show up.
You're not bored. You're watching TikToks.
Okay, just do the list already.
Let me remind you that none of these things are optional.
Go already.
If you want me around you, this is what you're gonna have to do. Do you have the right neck support, the right pillow? Not the flat one. Where's your holdy pillow? And the pillow between our knees? Okay. Is the fan on? Okay. The blanket, is it cool but also warm? Do you have the weighted blanket?
Yes.
Is one leg slightly outside of the covers, but not too far because of the monsters? Okay, it looks like you've got everything I need here.
Actually, before you take over, I did have some things I wanted to quickly review with you.
You know, it's fine. Just take all the time you need.
Yeah, I just want to spend the next 3 hours thinking about the top most embarrassing things you've ever done in your life.
Are you kidding
And
me?
then we can move on to the top 50 reasons why people hate you. You can try to clear your mind. Grab some paper and a pen. Jot down the things on your mind. Did she have you spray some lavender aromatherapy on your pillow? Now prevent light seepage from going into your eyes. Repeat a mantra, say your prayers, or do an A to Z gratitude list in your mind's eye.
Okay.
Night-night.
I am so good at sleeping. I can do it with my eyes closed.
Hi, I'm Dr. Kimberly Bensen, and this is Feeling Groovy. And today, as our guest, is Carrie Adams. She has a master's degree in integrative health studies and a certificate in Western herbalism. She has a very deep knowledge of health botanicals and supplement. And for 25 years, she's been providing personalized therapeutic herbal solutions for our community here in Los Gatos. Carrie, you've had your pulse on the community of Los Gatos here and their health needs. Have you found that, well, sleep is a problem for them?
Yes, unfortunately it is. People have trouble sleeping. They have acute problems when something big is happening in their life, like loss of a loved one or a big change going on.
Stresses.
Yes, that's the underlying cause most commonly. They also, some people suffer from chronic sleep issues. Good news is that we do have an array of natural supplements that can help, whether whether the issue is acute or chronic.
Well, that's exciting to hear that you don't have to reach for a medicine, but you can solve it or alleviate it with herbs. And as a chiropractor, I have heard a lot of these same complaints from my patients. So I'm really anxious to hear what you have to say about the supplements that you brought for us today.
And so we touched upon one underlying issue of sleep disturbance, which is stress. Anxiety, troublesome thinking. So one approach is if someone is under a lot of stress, that they start earlier in the day and take a product to help minimize the stress, with the idea if they do that, that it'll be easier to unwind at night and go to sleep. So the first product I wanted to highlight is by Orgain, and it's called Restless. And it has a combination of herbs and some amino acids, and it is for daytime use. And again, the idea is that the person would take this midday to combat stress with the approach of making it easier to unwind at night and go to sleep.
So don't take it, 1 hour after you've gone to bed and you realize, oh, I'm not sleeping, let me take some of this. No, you take it earlier in the day.
This is a midday.
Okay.
This is your midday friend. Moving on into later in the day, this product here is by Natural Vitality. It's called Calm Mind. Calm has been around for a long time. This is a new product. This is magnesium, and they've added L-theanine, which is an amino acid. And so this product is really nice after dinner. So it's kind of a pre-sleep tea where you would have dinner, go ahead and mix this product in with some warm water, and you would enjoy it as a tea. It relaxes the muscles and kind of soothes the nerves. So it's a great way to unwind after the day.
Better than a glass of wine.
Yes, because that can be unpredictable, but this is a little more predictable.
I love it. I love it. Don't tell Napa Valley. What else do you have
Two products that someone could take at bedtime. So, and I brought one that's just herbal. The other one that I brought has melatonin in it. Not everyone wants to take melatonin. Some people report that they get bad dreams, nightmares or strange dreams with melatonin. So never fear, you can take a strictly herbal product to help. This product you would take at bedtime to help you unwind and go to sleep. The other one is a gummy, and it has melatonin in it. I like it because it only has 2.5 per gummy, so you could start at 2.5 if that works for you, great. If not, you could take up to 2 gummies, which would be 5 milligrams of melatonin. And that's for people who maybe the herbs aren't strong enough and perhaps they don't have the negative side effects from melatonin. This next batch here is for people who have trouble sleeping throughout the night. They pop awake in the middle of the night and they have trouble falling back asleep. So the first strategy would be to keep something by the bed, and when you wake up, have something to take. Now, this is unique. It doesn't work across the board for all these products. I chose valerian extract. It's alcohol-free, so it tastes good. So you won't shock yourself with a horrible taste in the middle of the night. And it's also not a ton of liquid like a tea would be. Like, that won't work in the middle of the night. It's too much liquid.
And you have to go to the bathroom. You can't go back to sleep.
Correct. It's just interrupting the sleep cycle more. So but the valerian, exactly, squirt maybe 2 full dropperfuls under the tongue is the fastest way to absorb. And also won't leave you too groggy in the morning.
Now that's an issue with some people taking like medications or even over-the-counter sleep aids, is they complain about the grogginess.
Yes.
And this one won't do that.
Yes, 1% of people, this valerian actually stimulates. You won't know which person you are until you take it.
Got it. So I'll be calling you at 3 a.m.
I'm the 1%. So I think it's a good idea to experiment with this during the day. And see if...
Like, you mean like nap time?
Yes, when you can't afford to be sleepy.
Okay.
Yeah, not before a job interview or something very important like that, but when you can afford to be sleepy, go ahead and try it to make sure that in fact it does relax you and make you sleepy and you're not the 1% that gets stimulated.
Oh, give Starbucks a run for their money. Okay.
Right. You would take when you go to bed, but it's for the person who is popping awake, so in that same category. This is Gaia's the brand, and it's called Sleep Through. So they're giving you the clue right there that's going to help you
through the night.
And it's just herbal, no melatonin. There's an herb in here, magnolia bark, that helps balance the cortisol levels.
And the cortisol is what keeps you awake, is that right? That's the fight or flight one?
Yes, I believe, don't quote me on this, but I believe it should be spiking at like 11 a.m. Okay. You know, you're starting your day, the day's getting going. But some people it's spiking at night. So the idea is let's just balance it out and help a person sleep through the night. Hero product is,
last but not least,
yes, Source Naturals Timed Release Melatonin. So the idea with this is it's melatonin, and it's going to time release to help a person stay asleep throughout the night. Not to be taken in the middle of the night because because of the grogginess. Yeah, it will help you sleep, but then you'll be too sleepy in the morning. So at bedtime.
Okay, so all of these are over the counter. Are they addicting? Do you have to worry about side effects? I mean,
I got these at the Whole Foods here in Los Gatos. Yes, and I want to mention, you said over the counter, which is true. My recommendation is the shortest term products to take, so maybe up to like 2 months, would be anything with melatonin in it on a regular basis. We just don't know. We don't have the data on what long-term use of melatonin does to the mind and body.
Melatonin versus herbs. Melatonin is not an herb.
Correct.
Okay.
Yeah, it does. There are some plant sources of it, but the fact is that we make our own melatonin. I believe it's the pineal gland that excretes it when the sun goes down. And so there is a theory out there that if we make it ourselves and we're supplementing with it, perhaps we might lose the ability to make it ourselves. Just a general theory. I'm not a doctor.
Certainly.
Yes, yeah. And anytime, you know, we want to rely on our own body's ability to do things, you know, when we can. Absolutely. You know, but at that, but you also, sleep is also very important to our mind-body health.
Great short-term solutions until
yes.
you put together a sleep regimen or a sleep hygiene or a way to get rid of the source of you staying up or waking up.
Yes, maybe some of the underlying issues transpire, pass, you work through them. It is good to check in, even with the valerian, maybe check in 3 to 6 months. Like, do you still need it? Any product that has ashwagandha, which I believe is the sleep through and the stress less, good after a year to kind of check in, and just see where you're at with how your body feels after taking that herb.
That's really good advice anyways. When you're taking something to supplement what your body should be doing naturally, get to the root cause when you can, right?
Yeah,
so
it doesn't hurt to take a break from it and just see how your body's functioning without it.
Well, this has been super enlightening. I am so glad I got to meet with you today and that you can tell us all about some sleep rescue remedies and herbs.
Stress contributes to insomnia or a hard time getting to sleep. This hack is a 2-for-1 or a twofer or a Nacho Libre. It helps get out your stress while you're preparing a melatonin-rich snack of pineapple.
Thinking of what's stressing you out and channeling Hulk Hogan, grab a ripe pineapple by the throat. Give it a head drop with a clean finish by twisting and pulling the hair off of it. Lights out. Slam the bottom into the counter while turning it. This repetitive signature move weakens the opponent. Be aggressive. Muscle it. This is WrestleMania here. Roll it out like Hulk Hogan wrestling at Madison Square Garden. More pressure the better, until it is sandbagging, limp, and cooperative. Like a ref intervening between two wrestlers, pull apart the eyes of this pineapple. Grab and pull. This is the finisher move. Go for the gold. It's a no contest win.
My sleeping pattern has changed in my older age. I go to bed much earlier, and I require 8 hours. I used to require 5 to 6.
Do you wear a CPAP machine?
Yes, I do.
How long have you worn it?
20 years.
How has that changed your quality of sleep?
It's so much better. I hit REM. That's great. I rest. I'm not tired when I wake up.
Thank you.
You're welcome.
Here are some nighttime sleep disruptors. Some of these may be medical conditions that you need to consult a specialist for getting some help. Snoring or sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts again. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea, and there are specialists to help with that. Pain. Pain and sleep are reciprocally related, meaning that sleep impairments reliably predict new incidents or exacerbations of pain. And pain can impair your ability to sleep. Medications. Consult with prescribing physicians. Commonly prescribed medications that act on the central nervous system can affect sleep, including
benzodiazepines, non-benzodiazepine receptor agonists, orexin antagonists, anti-seizure drugs, antidepressants, analgesics, and CNS stimulants.
Others are
beta blockers. Beta blockers are cardiovascular medications used to control heart rate and blood pressure. Diuretics, selective serotonin reuptake inhibitors, SSRIs, stimulants, laxatives, corticosteroids, and cold medications. Anxiety and stress is also another sleep disruptor. Excess worry and fear make it harder to fall asleep or get back to sleep if you've woken up in the night.
Another one is bruxism. That's clenching and grinding your teeth while you're asleep.
Active bladder, nocturia, inevitably impacts sleep due to the frequent nighttime awakenings to visit the restroom. You can restrict fluid intake at night, drink plenty of fluids during the day, especially water, but limit fluids 2 to 4 hours before you go to bed. Manage your use of diuretics, and don't turn the light on when you go to the bathroom, because you probably will go to the bathroom. Don't turn the light on. Keep a very dim night light to illuminate your path to the bathroom. So as sleep disruptors go, some things are within your control and some things you should consult a specialist for. So let's set yourself up for a good night's sleep. These things you have control over. This is your specific sleep hygiene.
Miss Sleep is a persnickety character. For a good night's sleep, she likes everything just so every night. Now, I like routine, weekends included. Our bodies like a routine, a rhythm, to go to bed at the same time, to wake up at the same time, and preferably with natural light. Your body doesn't know the difference between a weekday and a weekend. Establish a nightly routine to wind down before you need to go to sleep. Start 1 hour before bedtime. No blue lights before bed. This means TVs, phones, iPads, computers. Take a warm shower. Warming the body will put your body in a cool down mode, which triggers circadian rhythms, releasing melatonin. Eat a high protein, low fat snack, preferably one with tryptophan. I like yogurt. Have pineapple for dessert, as it also helps to release melatonin. Also, sour cherry juice. Drink it at least 1 hour before you go to bed, or I'll be sure to wake you up at 3 a.m. for a bathroom run. Also, I hate tobacco, anything with caffeine, and alcohol. If you're still having trouble, press on an acupressure point. Go behind your ear to the bump here and into the ditch. Apply light pressure for 60 seconds. 4 in, hold it for 7, breathe out for 8. Do this for about 10 rounds. Another acupressure point is on your pinky side of your wrist. 1, 2, 3 fingers down. There it is. And push on that with the same rhythmic, slow breathing. Remember, establish a pre-bedtime routine to help you to wind down. Whatever it is, that helps your body know that it's time for bed. Just do it every night at the same time. Limit your naps to only 20 minutes a day.
You want to take a nap?
I'm taking a nap here.
Okay, take a nap right there then.
I'm gonna.
Wake up at the same time every day. Miss Sleep, can't you and I be friends? We'll see about that.
I'm Kimberly with KCAT TV, and we're here feeling groovy, and I'm asking these youngins, what makes you feel groovy?
Going to the farmer's market and getting some good grass-fed meat and some good fruit. There you go.
So eating well makes you feel good. What about you?
Eating well and also working out always makes you feel the best.
I'm actually going to echo what he said. Working out just makes you feel better.
Do you think these guys work out? I think so too. They're
I would love to be paid to sleep. It would be my dream job.
Quality sleep is essential to our physical and our emotional well-being. My guest today says that sleep is your natural superpower and it affects everything. There are major consequences of continued poor sleep to our daily functioning, including, but not limited to, these things: our ability to cope with daily stressors, difficulty concentrating and completing tasks, decreases in our immunity, negatively affecting our general mood and our personal relationships, and family and social life can suffer. To help us understand sleep better, I brought in a nationally recognized sleep specialist, Dr. Alex Dimitriu. He is a dual board certified in psychiatry and sleep medicine. He also serves as a medical reviewer for the Business Insider and Sleep Foundation, and as a contributing author to the Encyclopedia of Sleep Medicine. In his practice, he uses a combination of psychological and biological interventions to optimize sleep for his patients. So welcome, I'm so happy you're here. With sleep disorders, what are you seeing in your practice?
So the biggest one I think everybody's familiar with is really insomnia. And there's so much about modern life and the speed that we try to do things and the amount of things that we try to cram into our days that I often joke that, the days get so busy that they've squeezed out our nights. And people just end up with, sleep becomes second priority and it's the first thing to go when we get busy.
How many hours of sleep do we actually need?
So there was actually an interesting study that pointed out that most adults, 7 hours is actually pretty good. In contrast to the 8 hours that everyone expected. This was a pretty large study done in the UK. And what they found actually that was interesting is that most optimal health outcomes have about 7 hours of sleep per night. Now, I say that always with a grain of caution or salt, because if you tell people to sleep 8 hours, they'll sleep 7 or 6. And if you tell people to sleep 6 hours or 7 hours, they'll always sleep less. So I think the goal is always to aim for 8 for most adults. And if you can get 7, you're doing okay.
What about napping? Does that count? I get a half an hour here, an hour there, 6 hours at night. Can we add it all together?
Yeah, so it's a great question. But and consistent with that, a lot of times people ask me about polyphasic sleep. There's some people that sleep in shifts or numerous sleep cycles during the day. Generally, the data is against that. And the less time you nap, the better. I think for everybody, a nap is okay if it's not longer than about 30 minutes.
I agree with that, yes. My cat does the same thing.
If you start napping longer than that, well, cats are excellent nappers, by the way. For most adults, I think you don't want to nap too long, because when naps are longer than that, you really have trouble sleeping at night, and that results in a poor sleep pattern.
But a nap
overall.
is okay if it's less than 30 minutes?
I think generally that's all right.
Mid-afternoon siesta?
Oh, I think a siesta is wonderful. There's a reason a large population of the world does that, but I think the goal is really to try to keep it to 30 minutes. But also realize if you're napping, like, you know, if you feel like this irresistible urge to sleep, are you getting quality sleep? You know, because usually, you know, it's okay to be a little tired in the afternoon. It's kind of normal for most humans, sometime around after lunch. But you don't want to be, you know, falling asleep in the meeting.
Right.
Or even worse, while driving. Those are generally indicators that there's something wrong with either the quality or the quantity of sleep that you're getting at night.
So with insomnia, well, people just can't sleep at night. They go to bed with good intentions, or maybe they're even sleepy, but they're not sleeping through the night, or they're not even sleeping at all. Is it normal to wake up in the middle of the night?
There is evidence, because we go through different stages of sleep during the night, that some people naturally have a tendency to wake up after they got their first chunk of deep sleep, which is usually those first 3-4 hours. And that's kind of like your core amount of sleep. Most people that have insomnia will generally get 3 to 4 hours, maybe 5 hours of sleep at night. It's not ideal. It's by far not great for their health, mental and physical, but it is survivable. But everybody has some tendency to wake up somewhere in the middle of the night, and that may be to go to the bathroom or to just wake up and roll over. But I think for anyone that's consistently waking up in the middle of the night and not getting close to 7 hours of sleep, it's worth looking further at what could be causing that sleep disruption.
What I'm hearing is if you wake up once in the middle of the night, that's kind of normal, because people have to go to the bathroom or roll over.
So most people can sleep through the night. And, you know, all of us, many of us might wake up and roll over and just kind of be awake for a second. Some people will use the restroom in the middle of the night. But I think once you start waking up 2-3 times a night, or it takes a long time to fall back asleep, then it's worth looking at it a little closer.
And what kind of solutions do you have at your practice?
So sleep loves rhythm. You just got to create the space for it and allow it to kind of happen. That means having a regular bedtime and wake time. Also, an element of slowing down a little bit in the evening and not answering emails right until bedtime, or watching some exciting drama on Netflix. All these things are, you know, they get people too excited too late into the night. Bright light, I think, as anybody knows that's ever gone camping, there's not much to do past 10 p.m. It's interesting, they've actually shown that a lot of people's sleep can get corrected when they go camping.
Is that right?
Yeah, just because you kind of get back into the natural element.
Well, you're also not on your right?
Yep.
But it also sounds to me like you're saying set your bedtime routine like you would a child.
Yeah, yeah. Sleep loves rhythm. It's a rhythmic thing. And to that point of rhythm, I should say also, one really common cause I see of insomnia, I've called it the flip-flop insomnia pattern. And people are notorious for this, but they oversleep and they undersleep. And it literally will sometimes alternate night by night, where there's a catch-up night where now they slept like 9, 10, 11 hours.
But you can't really catch up, can you?
Yeah, the data shows that catching up is not
I've tried
not
it. It doesn't work. Not since I was like 15. You know, sleep all day, stay up all night.
So as we get older, yeah, it gets harder and harder to catch up, I think. But people get in this pattern of like alternating undersleeping and oversleeping. Because after you've overslept, you will have insomnia that next night.
And you know what? That is the opposite of a rhythm and a habitual bedtime.
Exactly.
So we're talking about habits. So whatever you would do for your 2-year-old, do it for yourself.
Minus about 4 hours.
Minus 4 hours. Okay, for that kind of thing. Sleep apnea. A lot of my patients at the TMJ therapy clench and grind their teeth, which is called bruxism. And bruxism and sleep apnea kind of go hand in hand. So can you tell us a little bit more about sleep apnea, what it is and what it can do to us, and what are the solutions?
Apnea is like an inability to breathe. And essentially what happens at night, as I'm sure you've seen in your practice, people just kind of will fall asleep at night and their airway will tend to close up. And that happens because the muscles relax themselves at night. And as your muscles relax so you can sleep, and by the way, so that you don't act out your dreams, people will sometimes experience a collapse of their airway, because those muscles also relax at night. And when those muscles relax at night, and now your breathing can get a little bit impaired by the fact that you don't have the normal opening of the airways while you're sleeping. And people that have obesity, people that have small jaws, people that have Any issue with the air intake, including allergies that can cause nasal congestion, which then can cause mouth breathing. These are all things that are going to cause the possibility of the airway collapsing during the night. And your body panics because it's asleep. And oftentimes people will wake up numerous times during the night, sometimes not even to the point of fully being awake, but anyone that's had a bed partner who snores loudly has probably heard at some point sleep apnea, because at some point it becomes really loud snoring, and then you start hearing pauses in the breathing, or you hear that there's really just like a strong effort to breathe, and then people kind of catch up on their breath. So in the most severe cases, people wake up 30, 40, 50 times in an hour.
That's not quality sleep.
The simple equivalent of, somebody poking you every 2 minutes during the night. And that's what we see in people with sleep apnea. In terms of the solutions, I think there's a strong element of getting good sleep regularly. There is evidence that tired people also tend to have worsened sleep apnea. And it's a bit of a vicious cycle, because being tired makes your sleep apnea worse, and then your sleep apnea makes it harder to catch up on quality sleep. At minimum, watch your intake of alcohol at night, because that's something that'll certainly cause muscle relaxation.
Also causes people to be sleepy, but then it's not a good night's sleep. That's, you're sleepy, but you don't get that quality sleep with alcohol. Yep. All right, Napa Valley is out of the picture again.
It's better not to drink daily before bedtime. Getting quality sleep regularly is important. And you also want to be sure that you're managing your lifestyle factors. Being overweight can have a component of worsened sleep apnea.
So if people lose some weight, they may not have sleep apnea anymore?
There's a fair number of people that will get better if they have weight loss. Anyone that has a larger neck diameter is predisposed to having sleep apnea. Also, looking at people's jaws, I think, can tell us a lot about who's predisposed to sleep apnea. And if you have a small jaw, results in the tongue sitting further back in the airway. Mm-hmm. And then that has a greater likelihood of falling back and blocking the windpipe.
The people with sleep apnea wake up with dark circles under their eyes, feeling tired and fatigued, and all of the symptoms of a poor night's sleep. And they say, how is that possible? I was in bed, I didn't wake up once. Well, it's possible that you weren't fully awake and you were waking up all the time. That sounds awful.
To come back to your point about the siestas, that was an interesting point, because what I see is that everybody gets a little drowsy in the afternoon, but people that slept poorly really get sleepy in the afternoon. I called it the canary in the coal mine for poor sleep. Anybody that's had a bad night of sleep will be not just a little drowsy in the afternoon, but substantially so. So I think it's really worth looking and investigating. How sleepy really are you in the afternoons? And if you're exhausted, wiped out, that's generally a good marker that your night of sleep was not good.
And if you don't have a partner telling you you're snoring or getting the elbow, then this would be a good indicator to go see what you have to offer.
And there's some good solutions there as well. There's some great apps right now that you can get on your phone that record audio all night. And then you don't have to rely on your bed partner or the person you're sharing the hotel room with.
Yeah, there you go.
Those apps will record audio all night and let you hear like how loud you were when. And for anybody that wakes up in the middle of the night, it's useful to hear what did you sound like right before you woke up. Mm-hmm. I'll emphasize, this doesn't replace a sleep test. However, it is useful information to know what you sound like at night.
Absolutely.
Especially after the 2 glasses of wine that you had at 10 p.m.
That made you sleepy to go to bed, but didn't let you really sleep.
Exactly.
We've got some problems. We got some solutions. What else do you offer at your office? Do you do sleep apnea testing? Yeah. And what's that like?
Yeah, so sleep apnea testing, most tests these days are home sleep tests. Those are pretty straightforward. It's wearing a device about the size of a smartphone on your chest, not a bunch of sensors. It's really a sensor on your finger to measure pulse oximetry, a sensor around your nose, like a little tube that just measures airflow. And that's pretty much it. You wear it at home, you sleep in a natural setting, and that usually gives us pretty valuable data. For people that have more interesting or more complex presentations, maybe restless legs or REM behavior disorder is another one. Those conditions are usually better diagnosed in a sleep lab with in an actual clinical setting with an EEG on the head as well.
Oh, right.
And those are a little more disruptive to natural sleep, but they're still very informative.
I always thought if I had to go into a sleep lab, people are watching me while I'm sleeping. I will never go to sleep. Who knows what sounds are coming out where? I don't want anybody to know. What about sleep apnea masks? Do you prescribe those?
CPAP is usually a good first go-to. But I should say even before that, we'll always emphasize lifestyle factors as well.
Lifestyle factors first. Go natural. Yeah.
CPAP is usually a good start because it's reversible. Surgical interventions, a bit more permanent.
Right.
And then there's also myofunctional therapies and other approaches as well that just require a bit more patience and time. Sometimes a CPAP for me is a good way to show them, well, this is how good your sleep could be. And then we can always look at other more commitment based treatment.
That's a great solution. Let's see what you could feel like when you feel good. You didn't know how bad you felt until you started feeling good. And you might be also a little bit more inclined to lose that 10, 20 pounds when you can see the difference, right?
Yeah, and if it could mean for some people that have milder sleep apnea, that weight loss could actually get them off the CPAP machine.
Oh, that's encouraging.
A good night's sleep is so precious. I mean, the amount of the level of impact it has on everyone's daily life is tremendous. And I think really for me in my practice doing psychiatry and sleep medicine, sleep is just like the backbone of mental well-being.
I absolutely agree. I'm a lot crabbier if I don't have a good night's sleep.
Crabbiness is actually a really good point because I think
a technical term?
It is. It's a medical diagnosis actually, and what I see the most and that's always fascinating. Sleep really helps people with impulse control. Impulse control is the ability to stop eating potato chips. It's the ability to stop letting that thought bother you. It's the ability to tolerate things and be more patient longer than you would be if you hadn't slept. And having impulse control helps both metabolically for what we eat, but emotionally also for what we take in emotionally, in our ability to stay centered, in our ability to turn thoughts off so that they don't run wild, and our ability to say no to some recurring thought that keeps you up at night.
Or I can see Amazon going out of business with our impulse control under wraps. I want to talk about restless leg syndrome. That's where you're in bed, you think you want to go to sleep, and your leg's kicking, and your partner's kicking you back, and nobody gets any sleep, and it's an awful thing. I've had it once or twice. I don't know if it's the syndrome, but it's just super uncomfortable and annoying, and I can't get any sleep. What is that about?
I'm glad you brought it up because actually a lot of people with insomnia, I'm always surprised, a large portion of people with insomnia actually turn out to have RLS, restless leg syndrome. And they kind of didn't know it. They were just thinking that they're squirrely in bed.
Another technical
What
term.
I think is important to recognize, though, because everybody gets a bit of a jerk as they're falling asleep. It's quite common, and it's not restless leg syndrome. Then there is restless leg syndrome, which is now, it's a desire or an urge to keep moving the lower extremities. It should, by definition, happen in both legs, not just one side. It should follow a circadian pattern, which means it happens only at night, be alleviated by movement. There's lots of causes for it. Having low iron can be a cause of that. Iron is important in...
Low iron? I have not heard that. Okay, interesting.
Restless legs and dopamine have a very close relationship that's important to explore because certain medications, even psychiatric medications like SSRIs, can actually lower dopamine levels a little bit. They say there's like an inverse balance between serotonin and dopamine, and having a little more serotonin can actually result in lower dopamine levels. And those lower dopamine levels can actually cause restless leg syndrome.
Side effects may include.
Indeed. Certain psychiatric medications also block dopamine, and that there too we see people develop RLS that may not have had it before. Some cases of RLS just kind of come out of the blue or they're familial.
Could it also be a like muscle tightness or magnesium electrolyte imbalance?
But magnesium has a muscle relaxant property which may help a little bit with RLS. Speak to at least their internal medicine doctor. Now this is now not just the legs. These are people that actually will punch, kick, run in bed throughout the night because they're acting out their dreams, and if they're dreaming of a race, then their legs are actually moving as they sleep. So it's important to actually make that distinction as well.
Very informative. Is there anything else you want to tell us about your practice and how you can help people who aren't sleeping well?
I can't say enough about the importance of sleep, and I just wish more people in the medical community recognized that it's one of the pillars of overall health, focus, mental clarity, metabolism, immunity. I mean, the list goes on and on, and unfortunately we've really just kind of primed ourselves by the speed of life these days to just not really permit the right amount of time for sleep. And I think the health consequences of that are tremendous. Even as we see diabetes type 2 exploding and obesity and the rates of use of psychiatric medications, I really have a belief that if people got more sleep on a consistent basis, we could probably cure maybe half of those issues.
Wow, we need to start prioritizing a little bit differently in this culture. Yeah, I agree. And a lot of these things are just you doing the next right thing. It's not taking a drug. It's not going to the hospital. It's, get your habits in order, get a ritual down.
But also to your point, Kimberly, so many people are caught up on yoga, exercise, healthy dieting, all that, but then they don't sleep at night. I just can't emphasize enough what a priority that should be. That should probably be the #1 priority.
We are here to tell all of Los Gatos and Monte Sereno area and anyone else who's watching this show that sleep should be the #1 priority. Take it from the expert. Thank you, Dr. Alex
Pleasure to be here.
Dimitriu.
Thank you so
I really
much.
appreciate it. Thanks.
Scientists have finally discovered how much sleep humans really need. 5 minutes more, please.
Here's today's sleep playlist to put you in the mood for a better night's sleep. Dreams by Fleetwood Mac. Trouble Sleeping by Corinne Bailey Rae. Don't Know Why by Nora Jones. Matt Mayer's version of the Lord's Prayer. And the Mamas and Papas, Dream a Little Dream of Me, as sung by me. Until next time, sleep well and let's keep feeling groovy.
Stars shine bright above you. Night breezes seem to whisper, I love you. Birds singing in a sycamore tree. Dream a little dream of me. Say nighty night and kiss me. Just hold me close and tell me you miss me. While I'm alone, blue as can be. Dream a little dream of me. Stars fading, but I linger on, dear. Still craving your kiss. I'm longing to linger till dawn, dear. Just saying this. Sweet dreams till sunbeams find you. Sweet dreams to leave all worries behind you. While I'm alone and blue as can be. Dream